So what happened to your finger?
I was chopping up some vegetables for dinner and accidentally cut my finger.
Oh, well, at least you didn't get the tip.
Yeah.
I'm just gonna wipe this off, okay?
Mm-hmm.
And then I'm going to clean with some alcohol. Let's put some concentration on here for you. It's gonna keep it from getting infected. It's medicated stuff, okay? I'm gonna give you some of this to go home with. Okay?
Mm-hmm.
Along with a Band-Aid and everything, so you can change it later on tonight if you want. I'll actually give you this one since I put this directly on your skin. Okay?
Mm-hmm.
Hi, my name is Faith Doherty. I'm from Jacksonville, Florida, and I have wanted to be a nurse for as long as I can remember. I love taking care of patients and making sure that they are in good health and both physically and emotionally. When I take care of patients as Army medic, I love the satisfaction I get from knowing that I have had a hand in their care, even if it is just for a cut. I believe that nursing is both an art and a science. It's an art because you have to have the needed skills to take care of a patient and know how to apply them when it comes to treating them. The science of nursing comes into play when you have to think about how certain medications can harm or help them. Knowing if a patient is in dire need of care when they come into the hospital or the doctor's office based upon their signs and symptoms is a must. Just gonna check your blood pressure real quick. Okay?
Mm-hmm.
Your blood pressure, it's not too high. Let's just check your temperature. Lift your tongue up. Let's take your temp. All right, your temperature is normal. So what I'll have you do is I'll have you sit out in the waiting room, and then as soon as I get a room available for you, we'll call you back. Sir, he seems to be having some trouble breathing. How long has this been going on for?
It started about 30 minutes ago. We gave him his inhaler, but that wasn't seem to be working, so we took him to the hospital.
All right, his pulse ox is showing that he's not getting enough airflow, and I can also tell that from his breathing. So what we're going to do is give him a little help breathing, give him a nasal cannula. So it's going to go into his nose. You understand? It's going to help you breathe a little better, okay? All right. I believe nursing exists to fill a void that the doctor isn't able to. Nurses are there to not only help provide care, but to also be a support system to patients and their families. Some patients, when come into the hospital, come in alone and with no one home to help take care of them. They may even go in and out of the hospital just to have company, or they are constantly sick because they are not emotionally supported and they live in bad environments. It is up to us as nurses to provide that extra support that is needed, even if it's only for a short time. Methodist University's vision for nursing in the future is to be able to provide the healthcare community with nurses that not only have the book knowledge of what it is to be a nurse, but who can also put it into action. It wants its nurses to have a holistic approach to healthcare, who are passionate, caring, and know how to work with others as a team in order to make sure their patients receive the best care possible. I know that I will face many challenges as a nurse, both emotionally and physically. Sometimes I may even feel like I could have or should have done something better, no matter what the situation is. I will also face the challenge of finding a job fresh out of school, even if I may have some medical experience. My goals for professional development are to become more knowledgeable when it comes to new and different practices in the healthcare field. get into the nursing program, study more, try my best not to get defeated when I don't do my best, and to graduate and be able to provide a more financially stable environment for my family.